2, 3.
We are thrilled to be here today. This is our ribbon cutting ceremony and official dedication of this building to the citizens of Livingston Parish. We have been working on this building through design concept for the last 4 years, and it is a tangible sign of a $32 million investment in Livingston Parish. We're going to start off with approximately 100 employees here, and eventually we'll grow to close to 300 employees at this facility and site. We have 3 clinics, as well as radiology diagnostic services, diagnostic cardiology services. We have an outpatient lab, and we also have rehabilitation services where we're providing physical therapy, occupational therapy, speech therapy, as well as audiology and sports medicine here at this complex. Our 3 clinics include a walk-in clinic, a family medicine practice, and a multi-specialty group. And in that multi-specialty group, we'll have 5 different specialties. We will have cardiology, internal medicine, ear, nose, and throat, neurosurgery, and orthopedics here at this complex.
Similar to Hammond, Livingston Parish has become an area where people used to say, I need to go somewhere else for health care. When 10, 15 years ago, when I first came to North Oaks and Hammond, there was that mentality that you had to go somewhere else for health care. We've overcome that hump, and now our people in the parish have, direct access to all their needs and their healthcare needs, and they don't need to go to New Orleans or Baton Rouge anymore. This is a state-of-the-art facility. You don't need to go to a big city to get your MRIs and your CAT scans and those kind of technologies. In addition to that, we have full rehabilitation capabilities. We have North Oaks actually employs the most PTSTs and OTs in the state. As a group, we have, I believe, over 60 of those specialties here. So everything from athletic training type rehabilitation to rehabilitation for strokes and knee replacements can all be done here instead of having to travel for a significant piece.
The convenience of being able to have a hospital and services here saves an hour-and-a-half drive into Baton Rouge and other areas, and our people will tremendously support this project.
And this was an opportunity for us to expand our commitment to the Florida parishes by putting a tangible site here in this community. So with this complex, it'll bring us to 5 clinics, the 2 we have in Walker that will remain, and then the 3 we'll add here, plus this diagnostic. And we also have a conference center here too.
We handle everything from acute diseases, sore throat, fevers, that sort of thing, to chronic medical problems, diabetes, asthma, hypertension. We see everybody from 1 to 101.
We will be doing adult diagnostic medicine, which includes treating patients from 15 to 100, I guess, and any type of illnesses that adults get, such as diabetes, hypertension, cholesterol issues, congestive heart failure, stomach issues, liver disease, orthopedic diseases, general adult internal medicine. Patients that need to establish with a physician to treat their chronic medical problems would come to an internist.
We take care of anything from the age of 3 months to adults, sores, colds, sore throats, fever, flu, abscesses, lacerations, abdominal pain, multiple minor illnesses and injuries. We've been doing this in the clinic that we have in Walker. We've been doing this for about 6 or 7 years. It's myself and 2 other doctors. We'll be rotating, and we give excellent care. It's usually not much of a wait. We're not an emergency room. We try to tell people that we don't take care of head injuries, we don't take care of chest pain. Anyone who thinks they have a seizure or stroke, we don't see those. But most other small illnesses we can handle. No appointment is necessary, just walk in.
We are centrally located on the I-12 growth corridor, and there is tremendous opportunity for growth along this corridor, and we are so proud to be a part of it, and we intend to be a leader and set the pace in the future of healthcare for this region, and part of that is our partnership with Livingston Parish. North Oaks is a 50-year-old community-based hospital organization, so we have served the Livingston Parish community for over 50 years now, but this is This is our 5th facility within the parish, so we've got a larger footprint here in addition to our facilities that we have in Tangipahoa Parish. So what this says about Louisiana and Livingston Parish in this area to me is that there is opportunity for growth and for progress and also for economic development. In fact, this facility will bring 100 new healthcare provider jobs to the area with a $4.4 million payroll and a $13.2 million economic impact to the area. So we're very proud to be able to do that.
Oh, this is a fantastic facility. It's one of the finest facilities we've built. When we were low bidder on it, we were very excited. When we were awarded the contract, we were excited. We had a great working relationship with North Oaks throughout the project, along with the Gasaway firm. And to finish the project and to have this kind of turnout and this kind of gratefulness from everyone and congratulations is really a big thing for us. It was very exciting.
It's a pleasure to be part of this dream. It basically is a great day for me because you develop a project from just a basic sketch, an idea on a napkin or a small piece of paper and come up with a concept and then develop thousands and thousands of details to come up with a magnificent facility like this. We tried to carry the image of North Oaks over here to Livingston Parish and use some of the materials, and we've utilized it at the Hammond facility and also designed a building where it's visible from all sides, in that it basically acts as a signpost from the interstate also. And as you enter the front of the building, it kind of draws your eye, draws you into the facility and be isolated. With also a separate entrance in the rehab department. And then we have this main lobby here to just give you such a great feeling from which all the other elements radiate. I'm just proud of it, and I'm glad that North Oaks gave me this opportunity to realize this dream.
We have a full-service facility here: family medicine, specialty medicine, labs, radiology, and we're more than happy to take care of them and their families.
For the long term in Livingston Parish, we're very proud to partnership with North Oaks, glad to have them here, and we're thankful that they stayed committed to building this parish, and I think it'll be a great relationship.
Well, tonight we are here at the North Oaks-Livingston Parish Medical Complex Community Celebration. We have invited the community at large to join us as we debut this wonderful facility to them. What we've done as the cornerstone of our celebration tonight is partnered with the Livingston Parish School System as well as the Arts Council of Livingston Parish to sponsor a coloring contest for 4th grade students in the parish. And we've actually awarded 72 of those students with 1st, 2nd, and 3rd place honors. So we had a winner in each category from each school, and then we also partnered with the high school art programs and had students submit original artwork with the theme of the Changing Healthcare Canvas, and we're going to put those pieces on display permanently here within the facility. And because the coloring contest entries were so wonderful, we've also made the decision to put those on permanent display here tonight. So with that said, we were able to really draw the community in and get them to come in and celebrate the accomplishments of their students, but also celebrate the opening of this fine facility. We also had first responders from the area, the Livingston Parish Sheriff's Office, as well as the District 4 Fire Department, and the Town of Livingston Police Department and Acadian Ambulance come out and join us with demonstrations on safety for all of the community members who came out tonight. And we also had Pelican State Credit Union come out and help us with face painting as one of our community partners. We've also, in this wonderful conference center, which we will use for health education, we're sponsoring a health fair where we're doing free health screenings, we're doing chair massages, we're demoing how we can be used in rehabilitation therapy. We also are doing a teddy bear first aid clinic for the children, and we're giving away information about our services and inviting the community to come back for the debut of the conference center's first health education venue, which will be a Change of Heart Expo, and that will be February 26th. What grand opening would not be complete without tours for the community. So we actually are putting on guided tours of all of the modalities within the complex, and we have mock patients so that we can demonstrate to the community how each of the pieces of equipment we've brought in work. Especially helpful in our radiology department, where you can see how the advanced technology we've brought in from GE for CT and MRI and all of that works, as well as in our rehabilitation gym, where you can actually see how we use our kitchen to help in occupational therapy to help our patients get back to those activities of daily living, and in our courtyard that we have, where we have different surfaces so that our patients can practice walking on different surfaces such as loose gravel and concrete, and so they can get back to their activities of daily living in a controlled environment where they've got somebody watching out for them. Those are just some of the things that we're offering tonight. It's important that the community be involved because we are doing this for the community. The community is the reason that we're here.
Use the facility and you'll find this is some of the greatest people. North Oaks has been some of the greatest people to work with all the way through this project. I hear nothing but good about their clinics there in Walker. That when I was mayor, we brought one in there. And I would ask people just to get off of the interstate. It's real quick, it's right here, and it's easy to get to.
I would just like to thank the Livingston Parish community as well as the surrounding communities that have come out tonight to support this event. We have had an overwhelming response. We've had, I think, last count, 800 members of the community who've come through tonight. And at our ribbon cutting ceremony this morning, we had almost 300 members of the community come out and support us. We are so touched by the response. We want to thank everyone. We want to thank everyone who is a patient of North Oaks for their loyalty, and just remind them that with their continued loyalty, we can continue to expand the scope of services that we offer in this region. And we just want to let them know in closing, you are the reason we're here.
The only way we can stay here is if they come out and utilize our services and come see our doctors, because we truly believe that we have the best doctors and we have the best staff. And about 11% of our 3,000 people that work at North Oaks through physicians, volunteers, and employees live right here in Livingston Parish. And so the majority of the people at this complex are the ones that live at this parish. So we were thrilled that many of the people that came from Hammond that work there are now utilizing this site as their home base. They wanted to come home to care for their neighbors and friends.